Hi, I'm Barbara Homer and I'm employed by the Southern PHO as a practice manager support person. A common question I'm asked by other practice managers is how can we fit in more heart and diabetes checks and help people to quit smoking in our everyday practice. The days are crammed full as they are, and the last thing anyone wants is more paperwork or data entry. Despite consistent time pressures, the general practices I work with do want to offer the best care for their patients and are generally happy to comply with the Ministry of Health's reporting requirements, so long as they know how to take the hassle out of doing so. The first thing I recommend is setting up your patient management system and IT tools to prioritise cardiovascular risk assessment and smoking quit support. Make it easy for your clinical staff to record the right information in the right places. If you need extra support, ask your PHO or IT vendor to help. Check out what's on offer in the way of training and support from the Ministry of Health, Heart Foundation and organisations like Quitline.
Yep. Just take your pulse if that's okay.
Your clinical team, including locums, do need to play their part. Life is easier for everyone when they use the right read codes and consistently and systematically record all their assessments. A practice IT user manual can be a great way to support them and promote consistency across the practice. Some practices appoint their own health target champions. They keep the team focused, enthused and up to date with best practice approaches. It's a great way to keep heart and diabetes checks and help for smokers to quit on the agenda. There are a few simple things your admin team can do as well, like making sure all new patient enrolment forms include a smoking status question. They can also help set expectations with patients by displaying posters, pamphlets and material about heart disease and smoking for patients to look at or take with them. Perhaps your best kept secret though is your nursing staff. Make the most of their skills and make sure they receive the training and incentives they need. General practice nurses with access to audit tools can undertake behind the scenes data cleanups and use hospital discharge information to keep patient files up to date. They can also use audit tools to identify eligible patients due for a cardiovascular risk assessment or who smoke and are eligible for smoking quit support. Contacting people using a mix of letters, email, phone calls and text messages can work well. Finally, many practices do well with nurse-led clinics. If the clinics are free to patients, even better. It's a constant challenge getting people to come in if they feel fit and healthy, and removing the cost barrier will help. It also helps if you're flexible with appointments and take a patient-centred approach. This might include having free early morning appointments before work and running evening and weekend clinics. These are times when people are more likely to be willing and able to attend. Some general practices like to invite eligible patients who have not been risk assessed to come in for a free appointment during Heart Week, or offer incentives like a free cookbook or chance to win supermarket or petrol vouchers to get them to the clinic. Others advertise their clinics through practice newsletters or in local newspapers. Homemade posters in your reception area and on community notice boards are cost effective and work surprisingly well.